In the fifth and final section of our lecture topic, now we will talk about the retraction pockets and patulous Eustachian tube. In this, we will talk about retraction pockets, patulous Eustachian tube, and examination of Eustachian tube. Retraction pockets, these are the retraction pockets in which the tympanic membrane, when it is examined, it is retracted backwards. So this is the picture on otoscopy of the retraction pocket. In the tympanic membrane lies lower as compared to the other portion, or as compared to the normal positioning. So this is the retraction pockets. Patulous Eustachian tube. In this patulous Eustachian tube, it's a patency of the Eustachian tube. So it's open as compared to the normal, so it's more open. So this is right Eustachian tube orifice, which is closed at rest, and then right Eustachian tube opens with swallow. So in this patulous Eustachian tube, it is patent, or it stays open, the Eustachian tube. Then the examination of the Eustachian tube, that's what is on examination you find. This is the fossa of Rosenmuller. Then we have torus tubularis. This is the raised end on the medial side, torus tubarius. And this is the fossa, is the pitted portion on the medial side of the torus tubarius, and then we have the nasal septum along with this. Thank you for watching sqadia.com.